People might say, well, just be glad you're alive. And I am. And I go, okay, I shouldn't be so vain to like want to get this taken care of, but like my pants can't fit anymore. And it's uncomfortable because it doesn't feel like me. And of course, my giant scar and my port scar that's there. So, when I look in my body, it's like, but I take these as my war wounds, my survivor wounds that I went to battle. And these are my war wounds. My name is Jennifer, and I live in Arizona. And I was diagnosed in 2023 with stage 3 kidney cancer and stage 4 ovarian cancer. It was clearly life-changing. I don't think anyone could have this experience without having it change them in some way. I think also it made me be more grateful for my life. I think I was kind of taking my life for granted in a lot of ways. And this helped me really live in the present moment and be grateful for everything that I have. I was moving from California to Florida, and I wasn't experiencing really any symptoms through that process. But then as soon as I got to Florida, which was June 28th, 2023, I got COVID a couple days later, feeling pretty icky for a few days. But I got through that. But then really soon after that, about a week or two, my abdomen started distending, and it was looking more and more like I was pregnant, and that was not even a possibility. So I was wondering what this was. And so I consulted with my brother, who's a physician assistant, and a couple of other doctor friends of mine, and they were giving me different things to take, like antacids, or, they thought there was something digestively going on. So I did a bunch of supplements and aloe vera, things like that, and nothing was working. And I just kept getting bigger and bigger. And I was staying with a friend until my daughter, who was 12 at the time, was with me in Florida. And we were staying with my friends until we found a place. And I showed her, and she said, Jen, I would go to the doctor because that's not normal. And I was very healthy. I wasn't overweight. I watched what I ate. I exercised regularly. I was a normal, healthy 53. I was 53 at the time. And so I went to the urgent care, and the medical person barely examined me, but he said, I think there's something going on that I won't be able to diagnose without a CT scan. So he encouraged me to go to the ER. And I went to the ER, and again, thinking, oh, this is no big deal because I'm healthy. I had no other symptoms. It was just this swollen abdomen. I went into the ER, and it was very quiet Sunday, and got right in. And they said, of course, they asked me a bunch of questions, and they said, yeah, we'll do. I had the order for the CT scan. So they did that. And a while later, the physician assistant came into this room that I was at, and she pulled the chair close to me, and I was like, oh, this doesn't feel good. Sort of like in the movies, like when they, you've seen people be told this diagnosis. And she said, yeah, I was really worried about you when you came in. And I thought she was going to say, but everything's okay. And so I kind of chuckled, and I said, oh, really? And she said, yeah, you have a lot going on. And I was like, what do you mean? And she said, well, there's a mass on your kidney that's 5.3 centimeters, and your ovaries are very inflamed. And so we need to do an ultrasound. Um, and so after they did the ultrasound, they was more conclusive that there was, ovarian cancer. So it was two separate cancers. It wasn't that ovarian did not spread to the kidney. It was two separate ones, which was shocking in itself. And I think at that point, I just sort of left my body. I was in so much shock that I couldn't cry. I couldn't feel really anything. I was just kind of numb. And then my friend went to get my daughter and she brought her in. And then, the weird thing is, I say I leave my body because I don't even remember the exact words that the PA had said. Like, I don't ever remember her saying, "You have cancer." Like, that's what was so weird. I had a friend up in Orlando who used to work at Advent Health there. And she worked there for like 25 years. And so she had a lot of connections there. And she said, let me get you in with one of the best ovarian cancer docs up there. And he was amazing. Dr. Kendrick was absolutely amazing. He called me on a Sunday night and he said, "Okay, here's the game plan. Go to the ER in Orlando tomorrow and tell them you're my patient and I'm on call and they'll call me to get this ascites, is what the fluid buildup is called, to get this drained." And I said, "Okay." And so that's what happened. And then when they admitted me, um, and they drained the fluid, he got me in surgery in 2 days. So it was very swift, and he basically saved my life. When they went in, they obviously didn't know that it had spread. So it had spread to my gallbladder and my spleen. So they had to call in a general surgeon to get those two organs out. And then they had a kidney surgeon in there to remove my left kidney. So I had a hysterectomy, uh, splenectomy, and nephrectomy, and then whatever the gallbladder removal is called. So I had most of my organs in there removed, but I was so grateful that it hadn't spread to vital organs like the liver or the lung or something else. So even with that, it was a lot, but at least I was like, okay, they got it pretty much through surgical means. After surgery, I had a scar basically from my pubic bone all the way up to, roughly, you can see, but a very long scar. And I was on morphine for 2 days, so wasn't feeling much. But and after that, I was very lucky, apparently, after talking to a couple of other survivors with the same type of cancer. I did not I was not in pain. Now, I don't know if I can't remember what they gave me in the hospital, on an IV drip that I didn't know, but I think it was like gabapentin and, no narcotics. I did not want to take any narcotics because I didn't want to have the risk of getting addicted to any narcotics. So I didn't take any narcotics. And I was only taking like Tylenol. And I really think that it was by the grace of God that I was being healed in this way and going through this process in such a graceful way. I mean, of course, after surgery, it was very hard to get out of the bed and do that. But once I started PT and moving, going up and down the hallways of the hospital and moving my body, I felt so much better. They didn't even give me staging or anything. So they just said, when I was coming out of it and I was in my room, the doctor said, "Yeah, so we didn't see this coming, but it had spread to your gallbladder and your spleen. We did see disease on there." They described it as looking like there was snow on it. I guess that's what disease looks like in there. And so they said, "Yeah, we had to call a general surge to get those out." And I was just shocked. I was like, oh my gosh, that's just crazy. Again, because I didn't have any other symptoms at all, so it was just very shocking. Um, and they didn't use the staging. So it was like there would be stuff on my portal, but I didn't read anything. I stayed away from the internet. I stayed away from even looking at my medical stuff. I didn't even want to, I couldn't even say the C word, for the longest time because I didn't want to affirm that for myself. I didn't want to attach too much to it. I didn't want to make that part of who I was, in a way. Or maybe it was because there was a certain part of me that was sort of in denial about it, that I didn't want to know that. I didn't want to associate myself with this deadly disease. And so um, I didn't see anything until later, and it said stage 3B. And so that's what I remember seeing first. And then it wasn't until I saw another report much later, like months later, that I happened to read something, a report on my portal that said stage 4. With ovarian, the typical course of treatment is 6 rounds. Could be wrong, but that's seems like that's what is kind of the norm. And so I had 6 rounds of chemo. I didn't have any radiation, just chemo. And um, they put a port in on my, before my first treatment. So I stayed overnight in the hospital for my first treatment. And that was good because I was nervous that I would have some sort of reactions or I wasn't sure what to expect. And so I was glad that I stayed overnight for my first one because they put the port in and then started the treatment later that night. So I didn't have any side effects or any allergic reactions, or I didn't have any reactions at all to it, which I was super grateful for. So, but after the first one, then I would travel up to Orlando. I think it was every 4 weeks, 3 or 4 weeks, I would have in between treatments. And so it was a very lonely experience because, again, I didn't have any family around. I had the couple that I was staying with. My daughter had gone back to California while I went through treatment because I didn't know how this would affect me. I didn't know if I could take care of her while I was, going through this. So it was extremely isolating and very lonely. There would be an occasional feeling of nausea, but I never actually vomited. I never felt super weak that I couldn't get off the couch. I mean, I really took the treatments very well. I wasn't, I continued to do my walking, and I think that helped too. I would force myself to walk every day because, and I'm not talking miles, just enough to really move my body and keep my energy levels up. And, I lost my appetite and so on. I lost 25 pounds from surgery. It was really surgery through, I was in there for 10 days and I really didn't eat much. Oh, I did have an NG tube in, and that was probably the worst part of everything. I hated that. That was so awful. But the point is, I didn't really eat much because I had this tube and so on. So I lost a lot of weight. But as far as like treatment, I did lose my appetite quite a bit. But, and I was, things obviously tasted that metal taste. They just tasted weird. Even water didn't taste good. But I did make sure to hydrate a lot because that was really emphasized to me to drink a lot of water, stay hydrated. So I did that. And I took a lot of, tried to take a lot of vitamin C. And So I really, I tolerated treatment very well. Some told me you can't really use cancer free until like 5 years. So it was more NED than I remember that kind of term being tossed around a bit. And then remission, they said, remission is kind of the term as well. So currently I am in remission and I do for the first year, I got scanned every 3 to 4 months. And now I'm every 6 months. So I'm due for a scan here next month. Um, I'm nervous about that because, it has been 6 months and that's the longest I've gone. So, talk to any survivor and I think they're going to say the same thing that anytime you go in for a scan, it's just anxiety producing and it's worrisome and it's scary. So I get blood work done every 6 weeks because I am on a PARP. So I am BRCA1 positive, which is something that I learned through this process. So because I'm BRCA1 positive, they put me on a PARP, which is, a medication specifically to BRCA1 positive patients. So I take that 2 times a day and I get the scan. And I also have to be on surveillance for breast cancer as well because of the BRCA1. It does increase my chances. So I switch off between mammogram, breast MRI, and ultrasound um, every 6 months. So, and I did, um, well, we don't have to go down that road, but so that's pretty much my surveillance is blood work every 6 weeks and then scanning every 6 months. I think the worst part was, of course, being separated from my daughter and we are extremely close. And so the decision to have her go back and stay with her dad for at least a semester of school, um, that was extremely hard because we have never been apart. And with that, being so alone um, and not having, anyone to sort of walk with me through this, it was just very, very lonely. And it was looking back, it was better that she was not there because then I could really focus on my healing and I could really focus on my treatment and taking care of myself. Because as moms, a lot of times we don't take care of ourselves because we take care of our kids sort of in place of that. And so it was a good thing that was a good decision to do that because she did go back home to where she was familiar because we were in a whole new place. We were across the country. And so she was going to have to adapt to a whole new group of friends and a school and a state, like everything. There was going to be a lot of changes for her and me. Um, but it's easier as an adult. So that was the hardest challenge. And just going through it all alone, going to chemo by myself, not having anyone there. It was really, there was times when I remember when I was going in to get my port put in, so that for that first treatment, and it was like everyone in the waiting room had someone except for me, and so in times like that, it was really hard. But there was also um, a sweet part of that too that I going through it alone. There was a strength that was almost um, had to be innately there. Like it almost made me stronger to have to go through this completely alone. Um, so there was a good and a bad about that. My physical body, like I have a hernia now in my abdomen from my surgery. So now my stomach actually looks kind of like how it did before, but it was just in the lower abdomen. There's like this big bump there because of the hernia from my surgery. So my intention is to get that have surgery done on that because it bothers me so much. And I know, people might say, well, just be glad you're alive. And I am. And I go, okay, I shouldn't be so vain to like want to get this taken care of, but like that my pants can't fit anymore. And it's uncomfortable because it doesn't feel like me. And of course, my giant scar and my port scar that's there. So, when I look in my body, it's like, but I take these as my war wounds, my survivor wounds that I went to battle. And these are my, these are my war wounds. I remember my mom always saying like, don't ever say why me when something bad happens to you, because why not you? And that's true. Like, why somebody else and not me? And so to make that even a bigger point of, to not, attitude, as I think we've all heard, attitude is everything when going through this experience. So to not go into a victim place, but to go into a place of empowerment and be your own advocate with the medical staff and the medical teams, and know that if you look at it from a experience of how can I learn from this, what is this trying to teach me? Why was this for me? Because I really believe that this was for me. Some ways I may never know what it was for, but and I'm still learning what those reasons are, but to never go down a hole of pity or anger because this happened, because there is definitely a reason why it happened. For one thing, it's to be, what I learned is just to be grateful for every day. And I think when something does happen like this, it sort of wakes you up to that. And for me, it's woken me up to really staying in the moment and appreciating life, and just not taking it for granted, because you just don't know. I mean, my life was going fine, and then all of a sudden it just completely turned on its head. So, really having a positive attitude and, listening to your body. And if something doesn't feel right, don't be afraid to go take a look and see what it is, because, it could be something that really, really needs to be addressed, and your chances of then surviving are so much greater if you catch it.